Hi everyone, thanks for watching my vlog, A Dose of Reason. I'm Dr. Shira Doron, an infectious disease physician and the hospital epidemiologist at Tufts Medical Center in Boston. Every week I look forward to answering your questions about the COVID-19 pandemic and sharing my thoughts on the latest news and scientific updates and breakthroughs so you can make the best health and safety decisions for you and your family. You can send me your questions to adoseofreason@tuftsmedicalcenter.org. Please include your first name and hometown with your question. I'll pick a few questions each week to discuss in the vlog. Well, COVID cases and wastewater viral levels continue to fall. Hospital capacity is much better, and elective surgeries have increased. On Tuesday, the Massachusetts Department of Public Health changed its mask advisory to state that vaccinated people are advised to wear a mask indoors only if they are not immunocompromised or otherwise high risk, or if they live with someone unvaccinated or high risk. This jives with the announcement last week about the school mask mandate ending at the end of February. I wanted to take a minute to talk about those who are immunocompromised and high risk and what they can do to protect themselves during this time that might feel scary, as many more people will be taking their masks off. And we know that being vaccinated doesn't prevent infection and transmission to the extent it used to in the early days of the vaccine rollout. First, one way masking works. If you're wearing a good medical grade mask that fits and filters, you are protected, and it matters little what others are doing. Second, we have treatments for people with COVID-19 that prevent hospitalization and death. It's important that you have test kits on hand, and they are now covered by insurance. If you get symptoms, test yourself right away and call your doctor if you're positive. If you have risk factors, you qualify for one of the pills or a monoclonal antibody, and we have plenty of each of them. Last, if you are immunocompromised and cannot mount a response to vaccination, ask your doctor about Evusheld. It's a monoclonal antibody injection that works like a vaccine to prevent COVID infection, but doesn't rely on your own immune system to generate that immunity. Our first question today is from Daniel from Dorchester. With many states removing mask mandates in the coming weeks, can you talk about how to properly wear high-quality masks so they are effective for those who prefer to continue to use them? I see so many people out in public who are wearing masks incorrectly, loosely, which seems to defeat the purpose. And N95s need to be fit tested, right? Daniel, you are right. Both fit and filtration matter. If you want to be protected against COVID-19, you have the tools to protect yourself even if the people around you are not wearing masks. Choose a medical grade mask, either an N95, KN95, KF94, or a surgical mask, and make sure it has no gaps and is comfortable enough for you to wear for as long as you need to. Now be careful of KN95s because they can be counterfeit. N95s, when used in healthcare, require fit testing, which is a procedure where we try on the N95 while we're wearing a hood, and a substance is sprayed inside the hood, and then if we smell or taste that substance, we've failed that fit test. And we try another type of N95 until we find one that passes the test. Since you don't have access to fit testing, you can do a seal check, and the CDC has a video online demonstrating that. Surgical masks have really good filtration though, but they tend to fit less well. There are ways to improve the fit and close the gaps, like putting a cloth mask over it, wearing a mask fitter, or using the knot and tuck method from CDC. Our next question is from Caroline from Brookline. As a parent of young kids, it's so frustrating to see yet another delay in approval of the COVID-19 vaccine for children under 5. When do you expect that kids in this age range will now be able to be vaccinated? Oh, the news that the FDA Advisory Committee will not be reviewing data on the vaccine for children under 5 after all is very disappointing. An emotional roller coaster, actually. First, we heard that we would likely have a vaccine for that age group early in 2022. Then we heard the vaccine failed for the 2 to 4-year-olds and that the company, Pfizer, was going to try a third dose to see if that worked. rather than starting over with a new group of participants and a higher dose, and that the results would not be available until April. Then we heard that the FDA asked Pfizer to submit their data anyway, and that they were going to consider authorizing doses 1 and 2 in February while awaiting the data on the third dose. Then we heard that plan was off the table. So now we have to wait until probably April to see if that third dose does the trick to bring the antibody levels up to where they need to be for authorization. It's unfortunate, but the good news is that with cases dropping, we're all getting safer by the day. Our last question is from Maria from Acton. I saw that a new monoclonal antibody treatment that supposedly works better against Omicron was approved this week. Is this the new best option for people who are infected with this variant, and when will it be available? Maria, both sotrovimab, which hospitals and state infusion sites have in pretty plentiful supply, and the newly approved monoclonal called bebtelovimab, appear to be effective against Omicron. They haven't been compared head to head, so we don't really have any reason to believe one is better than another at this point in time. And the state hasn't received a supply of the new drug yet, but we don't need it right now. We have plenty of sotrovimab for all who want it. I also want to mention that there's plenty of the oral pills, Paxlovid and molnupiravir. The hospitals and the monoclonal infusion sites got the pills first, but there wasn't a lot of demand, so now a bunch of retail pharmacies have the pills. So again, if you get COVID and you have any risk factors at all, call your doctor who can prescribe one of the antiviral pills or recommend that you get a monoclonal antibody. That's all the time we have for this week. You can send me your questions about mask mandates, COVID variants, our new normal, or anything else related to the pandemic or infectious diseases to adoseofreason@tuftsmedicalcenter.org. I look forward to dishing out a dose of reason to you again next week.